We saw a similar trend here in Milwaukee. According to police, 15 people were shot in Milwaukee over the weekend.
But there are organizations working hard to curb the violence. Jamaal Smith from 414 Life with the Milwaukee Office of Violence Prevention joining us right now. Jamaal, let's talk about this. Do you see that you need to be more preventative, or do you find yourself on the reactive end of what's going on in our city right now?
I think there's a mixture of both. We know that there is a need for a prevention strategy, and this is something that we've been stressing amongst the Office of Violence Prevention in many of our meetings amongst state, city, and federal officials. But also, as far as being reactionary as well, we've seen a lot of work that is happening amongst our 414 Life team, and I must give a lot of respect to our director, Derek Rogers, and his team for the amazing work that they've been doing in our communities.
Jamaal, take me to the prevention side of this. What is working? What is still missing from the equation?
Well, I think one thing that we have to look at when we talk about prevention is realizing the root causes of the violence that we see, right? We can't just look at violence from a interpersonal or communal aspect, but we have to look at it from a systemic and structural level as well, right? So we understand when we talk about the social determinants of health and the discussions that may be happening based on those social determinants of health being affected, so systemic oppression, racism, things of that nature, and how they contribute to a lot of what we see amongst the neighborhoods that have a high concentration of violence in there. So you can't talk about the need to deal with the symptoms of the violence that we see without dealing with the root causes. So there's a need to really address the impact of education, of employment, of home ownership. They're talking about segregation, talking about trauma-informed care, talking about mental health services. You know, all of these issues are things that need to be discussed and need to be elevated to a level of solvency as we continue having the conversation about violence.
Jamaal, how do we get buy-in from those that you just mentioned who are impacted by all of those institutional and systemic causes that have them in the space and places where they are? How do you get the buy-in, knowing what you know, and you being on the other side as well?
I think it's a matter of getting people to understand it from their own language. Like, for example, we're talking to business leaders and understanding the economic impact of violence, right? It's about $1 million to take care of one gunshot victim, right? So we understand how that impacts taxpayers. So how can we start to invest on the front end when it comes to prevention, so there's not a long-term tax liability or dealing with these types of injuries or whatever is happening within hospitals on the back end, right? So it's just, there's that language that we have to really speak amongst those different entities so people can understand how violence prevention, relates to their respective entities as well.
Jamaal Smith, we appreciate you bringing this to the conversation that is going on in our community right now. Thank you for your insight. Jamaal Smith from 414 Life at the Milwaukee Office of Violence Prevention.
Thank you.
Still ahead.